Good morning. I guess it's afternoon. Good afternoon, everybody. Thanks for joining us. Thanks for making this time work. I appreciate that. We begin, as we always do, by talking a little bit about where we are and a couple of precautions we want to talk about. So, the good news, and again, keeping in mind as we do every month, recognizing that we talk in numbers because that's how we measure what we're doing. But we do that knowing that we are actually talking about people when we say these numbers, and that using the very conservative number, which we do, which is that for every fatal overdose, if you assume that even 10 people are affected by that, and usually it's obviously much more, it really changes what it looks like. But we are now, well, I don't know, 5 weeks, 6 weeks from the end of the year. And again, having been where we came from years ago, I am still shocked that as it stands right now, we have had 86 non-suicide fatal opioid overdoses for the year across Middlesex County, which is a very dramatic decline, even from last year. Just from last year to this point, we are down by a little over 26%. The other good news is that our suicide deaths using opioids, which, as you recall, we have a very high bar for that. We do not name a death with opioids as a suicide unless there is just incontrovertible evidence that that's the case. So we have a note, we have statements, we have all of that sort of thing. And as you'll remember, that those numbers had spiked up pretty dangerously, but this month that number has gone way down. At this point last year, we were at 14. We are now at 6. So that's about a 60% decline. And that really is a testament to the seriousness with which you've addressed this issue in the work that's being done. So that is incredibly important for us. And particularly because where we were seeing that, the deaths with the use of opioids that we were finding to be someone having taken their life through suicide, tended to be much younger people. So that change really is an amazing response to the work that people have been doing. So we have a very full program for you today. I'm grateful to have Sabrina Gattin and Brent Kluntz from the Centers for Disease Control Foundation's Overdose Response Strategy team. They're going to talk about a resource for us to better coordinate our response to spikes like the one we've been seeing, because that's the other thing. I'll talk about a little bit about this later. That number that we are at, although still incredibly low, does reflect that since last month's meeting, so think about it, right? Up until last month's meeting, we were at 71 for the year. We've had 15 since the last meeting. And unfortunately, several of those have happened in a cluster. So it's been 2 or 3 people in one place. We are concerned about what's out on the street, very concerned about that. So we want to be talking about that today. I also want to mention 2 things that we've hosted since our last meeting. One was on October 29th, we hosted our first Empowering Citizens Conference. And that was the kickoff event for an initiative that I'm going to be running to help young people understand that democracy is facing a hard time, and it's up to us as individuals and collectively to be doing something about that. We had about 250 young people with us, both young men and young women at Cary Hall in Lexington. We had a great crew of people, including Dr. Richard Haas, the former president of the Council on Foreign Relations, Robin Brooks, the foreign policy advisor to Vice President Harris, as well as Patrick Moore, who did a program for us. And then just last Thursday, we had our semi-annual Empowering Girls program at Newton City Hall. We had about 350 young women, hearing from lots of women talking about how do you have perspective on life and how do you build a legacy. And I mention that because while they might not seem directly related to the task force, they are a part of our prevention efforts. We all know that kids that are engaged in school, engaged in the community, are less likely to be experimenting with substances and to fall into substance use disorder. So these events really help the kids to build self-esteem, help them create goals and connections. For instance, the second part of our Empowering Citizen program, which will be in January, we're going to have the kids picking two or three things, very manageable number of things they are going to commit to doing in their community by the end of school. It might be shoveling out their elderly neighbor. It might be holding a voter registration program, helping with food insecurity. And those things I think are just really helpful for people. I also want to talk for a minute before we get to our program about being extra vigilant as it gets colder, the days getting shorter, winter's coming. We know that both opioids and the cold weather depress the respiratory system, so it can put people at a greater risk for overdose. And also because opioids impede your ability to control your body temperature, unhoused individuals, particularly who might be using opioids, are particularly at risk for overdose and hypothermia. So to the extent you're working in the community and focus on that, obviously the cold and dark obviously increases depression and anxiety, and people turning to opioids as self-medication. So it's just a reason to increase our outreach. I also want to remind people we have lots of Narcan, lots of test strips. Happy to be making those available to anybody who needs them. All right, we're going to kick this off hearing from a familiar returning face, Katie Sugarman and Lizzie Calvin. And Katie is the Prevention and Outreach Program Manager for the Town of Natick's Health Department. She is the Program Director for the Natick 180 Coalition. So she oversees Natick 180's work to prevent and reduce addiction in the town of Natick. She works very closely with the town administrator and community members to coordinate their use of the abatement funds. And Katie's been in this field for about 19 years, serving Watertown and Revere before going to Natick in 2013. She is a certified prevention specialist and holds a master's in counseling psychology and a bachelor's in elementary ed and human development from Boston College. And Lizzie is the Associate Project Coordinator for the Natick Health Department's Natick 180 Coalition. And she particularly coordinates the coalition's work regarding youth substance use prevention, parent caregiver and community education, the school outreach, and the health communications. And prior to coming to Natick in 2021, Lizzie worked in a number of different fields, including healthcare settings, nonprofits, and higher education administration. Lizzie has a bachelor's degree from Brandeis and a dual master's degree in public health and social work from BU. So Katie and Lizzie, thank you for being here.
Thank you so much, DA Ryan. It's always a pleasure to be with you all. And we really appreciate this opportunity to share a little bit about what we're doing here in Natick. We have been doing coalition work for a long time in Natick, but in particular, we've done a lot around community awareness over the years to try to build the readiness. And I have to thank and acknowledge DA Ryan, who's really been a part of some of this work here in Natick around the opioid crisis since we really got started. I believe you were at our very first vigil, DA Ryan, as well as our very first Narcan training. Our work here in Natick, particularly around raising awareness, has been sort of critical to us getting some traction here in the community to take action around this issue. When we had our very first vigil in the spring of 2014, It was really in response to a cluster of fatal overdoses that we had experienced in town, and that were felt very deeply by the community. They were young individuals who were well known to the community, who had gone to our high school, and their families were longtime Natick families. And so it was our very first effort to hold a vigil here in Natick that started to get our community coming together to acknowledge how deep the impacts were of the opioid crisis here in town. And then that actually led to families in our community coming together to form a support group that's now a nonprofit called SOAR Natick. The Purple Flag Project that you see on the screen was a huge community awareness effort that really started to bring our community together in a very tangible way, and really started to build I think the readiness for our municipality to take action around this issue. We had parents in town who had kids who were either struggling with addiction or in some instances had lost a child to addiction, and their willingness to share their stories and to be vocal about the pain that our community was experiencing really left an impact on decision makers in town, and really raised the recognition that we needed to do more than talk about this issue. We needed to invest in addressing this issue as well. And so this sort of summarizes sort of the road that we've had here in Natick to actually operationalizing some of this work. We actually have coalition work in Natick that went back to the 1980s under the Dukakis administration, but later led to us getting the Drug-Free Communities grant from at the federal level. 2014 is when we experienced some of those losses that I referenced that led to our very first vigil and our very first Narcan training. And by 2016, we had a commitment from our select board, as well as our town meeting members, to fund a full-time position, which is the position that I'm currently in, to actually coordinate work around the opioid crisis. We also commissioned our very first opioid task force. We later got more prevention funding from the DFC grant in 2018, and by 2019, we merged our prevention work and our opioid task force into one body, which is our Natick 180 coalition that tries to prevent and reduce substance use disorder across the behavioral continuum. And I'm going to invite my colleague Lizzie Chelfin to just talk a little bit about how we do this work as kind of our philosophical and mission statement framing.
Thanks, Katie. Yes, so as Katie said, we have a long history which led us to where we are now, which is under our title of Natick 180. Something that makes our coalition a little bit unique to other coalitions that exist across the country or in other towns is that we really tried to address the 180-degree spectrum of substance use, hence our name Natick 180. So we have efforts on the education and prevention side, but then also the treatment and recovery side as well. And we've gone through different editions of our mission and vision statement, but the current one that we updated in the last few years is that Natick 180, we identify ourselves as being Natick's community resource for addiction education, prevention, and recovery. So again, recognizing the full spectrum that we look at. And we also address the factors that contribute to addiction, such as mental health or where you're raised and things like that. So we have expanded our vision to be broader than just substance use specific, because we understand it does not exist within a vacuum. And we also make sure that all of our work is driven by empathy, respect, science, and data, so that everything we do we know is backed up in the methods that we choose to move forward with. So for people who are familiar with coalition work, and DFC grants and things like that, we do use what we call the 12 sector model. So we have different partners all across town who are involved in our work, actually even some partners who aren't necessarily in Natick necessarily. Some of our hospitals and whatnot service Natick as well as other towns. So we do have very strong partnerships across the different sectors. Just to highlight a couple of them here, obviously we are embedded within the health department. So we do have a lot of support with town government structure and the health department. We have people who are on our steering committees and whatnot who are part of different boards and things throughout town, which Katie will elaborate more on in a little bit. We also do have a very robust youth sector to our work, which I'll talk about a little bit more going on. But we've been able to grow our youth side to the work a lot in recent years, and then just different groups such as businesses and civic groups and substance use involved folks or organizations, law enforcement, etc.
So without getting too deep into the way that we've structured our coalition work, I do want to just acknowledge that one of our biggest priorities in doing this work in Natick has been to make sure that we are constantly bringing a balance of voices to the work that we do. We recognize that with a coalition being embedded within a municipality, it gives us the unique kind of access and understanding to how town municipalities work, how decisions get made. You know, the reality is that having folks like our police chief and our fire chief and representation from our school superintendent's office, our public health director, and even liaisons from 3 elected boards, our select board, our board of health, and our school committee, having those voices at the table ensure that we, first of all, are informing those leaders of on the ground real-time information that can impact their decision-making processes, but their understandings of how decisions get made and how to you know, and how community voice impacts policy decisions that municipality makes, their understandings of the levers of government and how everything happens allows us to move things forward. But we also never want to be so lopsided that everything is being driven by the municipality that we are losing community voice. And so our steering committee has an equal number of folks from those sort of 2 sides of the spectrum. So we also have community representation from local nonprofits and groups that are really critical to our work. SOAR Natick is that family-led nonprofit that I referenced. Spark Kindness is a local nonprofit that does a ton of work around parent education and parent outreach and educating our community around youth development. Newton Wellesley Hospital. I saw Dr. Veriveld's name on the Zoom call. We have representation from Newton Wellesley Hospital in the form of Dr. Armstrong, who's one of Dr. Veriveld's colleagues over there, Metro West Medical Center, our Natick Interfaith Leaders Association, and then we also have local folks in recovery and family members in our community that serve on our steering committee as well. So we're constantly trying to infuse grassroots input, folks, the framing of voices from those who are on the ground with our leaders who can help us move efforts forward. So just to kind of let folks know where we are right now, we underwent a strategic planning process back in 2022 and 2023 that led to a strategic plan that we are still in the midst of implementing. It included a lot of both quantitative and qualitative data, as well, including focus groups and key stakeholder interviews. So the priorities that are currently driving our coalition work are around prevention and treatment for mental health concerns, especially since coming out of the pandemic. That is, I know, a priority that I think all of our communities felt very deeply. A real concern around community norms in Natick around alcohol and cannabis use as a focus for messaging for parents and youth in particular. And then, of course, harms from opioid and other illicit drug use and support for people seeking or maintaining recovery. And much of our strategic plan has helped inform the use of our opioid abatement money. Since we already had strong infrastructure here in town when the opioid abatement monies became available, our select board and town administrator, in working with members from our steering committee, kind of came to the agreement that it made sense to already take the work that was being done by Natick 180 and infuse our abatement monies to invest in some of those spaces. So our current priorities are around maintaining that coalition infrastructure so that the work can get done, so that we have bodies and positions to do all of this important work across the behavioral health continuum. We've used funds to maintain contracts for referral services and to support the community care connection that we're fortunate to have through Behavioral Health Partners Metro West. increasing and expanding access to naloxone and training for naloxone, as well as starting to invest more in sharps containers throughout the community. Making sure that we have early intervention services for youth and young adults, as well as making sure that we are connected to regional efforts to expand messaging and campaigns like the You Can Save a Life campaign, which we have had some regional efforts in partnership with communities like Hudson and Framingham and Ashland to get that campaign out into our communities. And then we are also really focused on trying to expand our engagement efforts with people in recovery as well as people who use drugs. So here are just a few highlights of our current work across this continuum. I'm going to invite Lizzie to talk a little bit about our prevention efforts.
Yeah, so as we shared at the beginning, my role primarily works with the prevention, education side, and youth work, although we're a very small office, so we all kind of do everything. But in the prevention space, just some recent updates that we have to share. So in terms of education, which we do try very hard to train parents, caregivers, community members, professionals, youth, etc. in the community, we are trained as a staff in a few different evidence-based curriculum. So one of which is youth mental health first aid. We're actually also more newly trained in adult mental health first aid as well, but we have not offered any of those as of yet. But youth mental health first aid, since our office has been trained, we've trained 142 people in that curriculum. And I would say too, like that offer stands, for this group as well. If anyone wants to be trained in that curriculum or any of our curriculums, we offer that to any of our partners for free. And then we also are trained more recently in the QPR suicide prevention training, and we've trained 84 people in our broad community to date. Also under this space of just education and kind of getting the word out about Natick 180 and the work that we do have a monthly newsletter that we send out. It goes out to a current listserv of 1,600 people, which has grown a lot in the past several years. We also do try to stay active on social media and all of that. So we have Facebook, Instagram, Twitter. We do not have TikTok yet, and different things like that that we're working towards. As for the youth side, this is actually a picture of some of our high school youth from this past summer. People are familiar with the CADCA conference. We brought 9 youth from Natick High School to the CADCA conference this summer with 2 adult chaperones. It was a great time, lots of learning. The students who participated got a lot out of it. And it's just great, I'd say, from their advisor perspective, just to see these youth equipped with like prevention language and skills and just new knowledge and data and all sorts of things that they did not have before that. And I am not exaggerating when I say that they are already begging to come back and do more CADCA conferences in the future. Several students really want to go and do the CADCA winter conference and have been letting me know their intentions very clearly. But yeah, so the group that we have at the high school, that some of which are in the picture here that you can see, they're called Natick Above Influence, or NATI. This group's been around for 10 plus years. It was on the smaller side post-COVID, just because kids weren't used to being in school and whatnot, and clubs needed to get back off the ground. But at this point, we have consistently every single week about 30 students who come to our meetings, and they're just doing a lot of really impressive work. They're part of the 84 movement, and they're getting grant money. I know it's not on this slide, but they've gotten $25,000 of grant money from the 84 movement in the past 2 school years, because they're just really passionate about different initiatives and policies and things that they want to do. We also newly launched, there's two middle schools in Natick, 2 public middle schools. We newly launched last school year they go by different name, but they're basically like Natty Junior. They're like the middle school version of the club. They're called Make Healthy Choices. They meet every single week and also have a pretty robust group of about 20 kids who come every week to that club. And we're about to get the second middle school have their own club as well. So the youth definitely keeping us busy, but it's great to be able to work all the way down to that younger age level and get prevention and just healthy choices and all of that put into the kids at a young age. Katie and I and Astrid from our office also regularly will visit the middle schools and do presentations for their health classes. So we actually meet with all 6th, 7th, and 8th grade health classes at least once. So students should see us 3 times before they finish middle school, just talking to them about different topics and things that they don't necessarily get in their health class. And we're able to bring in a different perspective, a different face to the work. So we've trained, or not trained, we've educated in classes about 3,000 students in the past 3-ish years, which is very exciting. And we also have the high school kids go down and talk to some of the middle school kids as part of that model, which is really exciting for both sides. And then just the last piece about like early intervention, as it falls under the prevention umbrella. We do have an I-Decide diversion program in Natick. I know several other public schools also have the program. Our office has been integral in helping get that off the ground. Also just creating like supports around that program, because while it has just like the strict like modules of education associated with it, we've helped kind of build it out to have like parent resources and further kid resources and literature you could look into and places you could go if you need help and things like that that are just beyond the curriculum itself, which has been very handy. And then our office, in collaboration with the public schools, also made about a year and a half ago what we call the Hawk card. So Natick's mascot at the high school is the Red Hawks. So the hawk was, from that, and it stands for the Health and Wellness Knowledge Card. And it's a resource that we've been trying to spread across the community as much as possible. It comes, as you can see here on the slides, as that's actually a magnet. We have it as wallet cards. We have it as, large sheets of paper we put in bathroom stalls. And it just gives people like the places they need to know to go to for 911 emergency level 24/7 help. So like 988 behavioral health helpline, etc. But then also ongoing help if they're looking for like referral for mental health treatment or substance use treatment or what it might be. So trying to do a lot in the prevention space.
Thanks, Lizzie. In the harm reduction and treatment space, our police department has really been amazing in terms of its work to support folks post overdose. We have been a part of the SIMS platform since it was first piloted here in Southern Middlesex County, and we still have we actually have had a jail diversion program clinician through advocates for probably a good 6 years now, but we recently just were able to expand to get a second clinician in order to make sure that we have embedded mental health clinicians covering as many hours as possible, riding along with our police department to both provide real-time behavioral health support, but also to assist folks when there are overdoses that occur in our community. We also have a relationship with SAD-OD, which is a family grief support organization. They actually have individuals who will provide support in the event that there's a fatal overdose to just ensure that surviving family members have adequate support for themselves. And we also have a bereavement group here in town started by a mom who lost her son. This has been in place now for probably 8 years now in Natick. And so we will also personally help connect folks to that bereavement support group if they're interested in participating. We also have been doing Narcan distribution and drug test strip distribution for quite a while now, and many thanks to the DA's office for helping us get our most recent batch of test strips. We offer those trainings throughout the community, both to individuals and to businesses and private organizations. We've trained over 450 people in recent years in how to use Narcan. And we also continue to maintain those referral contracts that I mentioned. And we were also really excited this year to pilot a transportation to get off the ground a transportation pilot through funds from the Rise Mosaic grant. We're doing this in partnership with 2 other municipalities, Hudson and Framingham, and in collaboration with Program Rise at JRI Health, which is a local agency out of Framingham. They have an Uber Health account, and using funds that we pooled across our 3 municipalities, as well as matching grant funds from the Rise Mosaic grant. Our transportation pilot will provide free transportation door to door for anybody who has been impacted by opioid addiction. So that includes an individual who might be still actively struggling with substance use disorder, and a person in recovery, or their family members. If they're trying to get to an appointment or a meeting that relates to their health and wellness, our funds will help get that transportation in place for them. So that includes transportation for the local recovery court that serves both Natick and Framingham, as well as transportation to treatment appointments, DCF appointments, anything you could think of, medical appointments, therapy appointments. And so we've seen a lot of success with that grant. So we actually just applied to try to get that grant again in the hopes of maintaining this pilot, because it has been found to be an incredibly successful venture and has been great in terms of building trust and connection for folks who for folks who use drugs and who, have oftentimes been really marginalized in a lot of our treatment systems. And then just sort of lastly, some highlights in our recovery work. We do maintain subcommittees where we have folks in recovery on all of our subcommittees. We're really active with our local recovery center, which is Anchored in Recovery, which is sponsored by SMOC. And we also work really closely with the Mass Organization for Addiction Recovery. That's our friend Sunshine Scotty there on the screen in his purple Moore sweatshirt. But we also work really closely with groups like the Natick Rotary Club and SOAR Natick, which have done a lot to actually provide financial support to folks who are in early recovery and might be encountering some financial barriers, such as trying to get first month's rent, or trying to resolve outstanding court fees, or trying to get their license reinstated. Those nonprofits in town have done a lot of work to fundraise to actually provide some financial support to folks in early recovery. And we've also used some of our opioid abatement monies in working most specifically with SOAR Natick to provide some financial support to folks who are trying to address some of those issues that can really derail folks' recovery. And even a few $100 or maybe $1,000 will help resolve some of those stumbling blocks and help folks continue on the recovery journey. And we do host a number of community events throughout the year, but especially during Recovery Month in September that are focused on recovery. So in closing, this is just sort of a snapshot of where our overdose rates have looked over the years since we really started tracking closely in 2016. We're actually, last year was our first year since we started tracking where we did not have a fatal overdose in town. Very unfortunately, we have had one this year, but our overall overdose count is down significantly, certainly aligning and mirroring with what DA Ryan said earlier about what we're seeing across the county. But I do want to extend an invitation to folks, if anybody is going to be in or around Natick in a few weeks. We will be having our annual vigil on Sunday, December 14th at the First Congregational Church at 5 p.m. That is the space that also hosts the Purple Flag Project in downtown Natick. It's right across from the Common, and it's always just a really touching evening that brings folks together so that we can enter the holiday season, remembering those family members and loved ones that we might be missing, really trying to, support the folks who are still in the midst of their substance use disorder fight, and also really to support the families who have been touched by the opioid crisis. So we welcome anybody to join us for that public event. And if anybody has any questions or wants to follow up with us afterwards, you're more than welcome to email us at natick180@natickma.org. That picture on the screen is Lizzie, myself, and our colleague Astrid. We are the 3-person team that staffs Natick 180. But happy to take any questions that anyone might have.
Thank you, guys. That was great. Thank you so much. If people want to raise their real hand, their remote hand, any questions, comments? All right. You got some kudos in the chat for presentations that you've done. All right. Thank you, guys. Thank you so much. All right. We are going to turn to Sabrina and Brent. Sabrina, serves as the public health analyst for Maryland with the overdose response strategy. And they partner with the Washington-Baltimore HIDA and the Maryland Office of Overdose Response. And in her role, Sabrina works to strengthen the data-driven cross-sector strategies aimed at preventing overdoses and supporting communities that are being affected. Originally from Maine, Sabrina holds a bachelor's degree in neuroscience from Hamilton College and a master of public health from Johns Hopkins Bloomberg School of Public Health. She focused on substance abuse and behavioral health in her studies. And prior to joining the Overdose Response Strategy Office, she worked with the Philadelphia Department of Public Health to expand low and no barrier vaccine access for people experiencing homelessness and people using substances across the city. Brent is a Maryland native and a drug intelligence officer, again with the Washington-Baltimore HIDA, and which is really known for helping to strengthen collaboration between law enforcement and the public health partners across the region. Brent has supported multi-agency teams in improving the real-time intelligence sharing, coordinating the response efforts, and really building practical strategies to make communities safer. Brent previously served as a detective with Baltimore PD, where he worked major investigations and helped develop early intelligence-driven models and citywide strategies in partnership, again, always working together across agencies. Earlier in his career, he served at the National Security Agency as a federal police officer and a dual-purpose K-9 handler, supporting high security operations along with federal partners. And Brent really brings to all of these jobs a steady solution-focused approach to working with partners, helping to move a project forward, building consistent communication, and taking what can often be very complex information and turning that into actionable decisions that can support both public health and public safety. And they're going to talk, as I mentioned, about the strategy overdose spike response toolkit and a tabletop exercise as well. So welcome, both of you. Thank you.
Thank you. Thank you for having us today. We're really excited to chat with you all about this great toolkit. I'm Sabrina Gattim. I'm the Maryland Public Health Analyst. I'm Amanda's counterpart here in Maryland. I'm sure you're all familiar with the Massachusetts team, but just to give you a little bit of an overview of the overdose response strategy, we're really a unique collaboration between public health and public safety. You'll keep hearing that again and again. There is a team of a public health analyst and a drug intelligence officer, myself and Brent, in every state, at least one team in every state. And we really work to improve communication sharing and partnerships between public health and public safety across the state. So the four big overarching program strategies for the ORS are to share data systems to inform rapid and effective community overdose prevention efforts, support immediate evidence-based response efforts that can directly reduce overdose deaths, design and use promising strategies at the intersection of public health and public safety, and disseminate information to support the implementation of evidence-informed prevention strategies that can reduce substance use and overdose. So again, really just working to improve those communication lines and figure out how we can all work together to reduce overdose. And I'll pass it over to Brent.
Hello, everyone. Again, my name is Brent Klutz, and I'm the Drug Intelligence Officer for the Washington-Baltimore HIDA. Back in 2024, and the reason we're speaking here today is about these overdose spike responses, tabletop exercises. Back in 2024, Delaware had a rather major overdose or a spike actually occur within their state, where we believe that was mostly benzodiazepine and fentanyl mixture, but they had so many that they had to be flown medevaced out to neighboring states. Not long after that, in June, our neighboring county to Baltimore, where I sit, Anne Arundel County, which it's a long length of county, spans from Baltimore down below DC, also contains our capital and our major airport, BWI, reached out to us wanting help with developing a exercise of mass overdose. So their emergency management system, due to the way Sabrina and I work together with law enforcement, public health, asked for us specifically to be keynote speakers in this exercise. For this, and this before we were able to use our ASTRO toolkit, it really hadn't been developed yet. We just kind of had to fly off the cuff with this with the help of Sarah Ali, our one of our administrators at the ORS. So we were able to put together some funds, well, FEMA was, in order to have this exercise within Anne Arundel County. So they had about 120 to 160 interested participants who wanted to come along and participate in this exercise as well. Who were able to capture in that were our EMS, public health, law enforcement, our hospitals, airport, and a lot of county agencies. I mean, we even had K9 unit there. As we went through these different scenarios, it ranged from people overdosing from an opioid on crosswalks to being on an airplane, and just how we work through those and what our systems would look like. Especially we have a fairly large encampment population here. That was also presented a different challenge. So by having these partners in the room and going through these different scenarios, we were really able to highlight and find gaps within our systems and then work through those in person. So as things developed, with ASTRO's toolkit and the ORS, we then thought it was a great idea, and Sabrina and I stood behind it. So we found great success with Anne Arundel County, and then we moved on to Frederick. And Sabrina, if you'd like to take it from there, that'd be great.
Yes, so we were very excited to hear that ASTRO and ORS had worked together to put this toolkit together, focusing on spike response efforts. For our first kind of cutting our teeth on this, we chose to work with Frederick County, which is pretty close to Baltimore, about an hour's drive. Brent and I, something we do as the ORS team in Maryland is take statewide tours. We try to break it into regions, and we'll spend about a week or so meeting with public health and public safety entities in Maryland. So really getting a feel for both the region and the county specific drug trends, any programming that's unique to them that they're working on. And it really helps us build those relationships and get a feel for how the county's working, what they're looking for, what we can help them with. So that being said, Frederick County was our top choice to bring in for this pilot exercise, and they were very enthusiastic as well. With this, we reached out to the behavioral health department within the health department of Frederick County, and they put together a team that included the COAST team, which is an EMS hospital collaboration, a representative from public health emergency preparedness, and a representative from the sheriff's department. So that's what we were going into this pilot exercise with. And they were the team really on the ground in their jurisdiction who could put together really who they thought would be great for the exercise, what would best fit their county, everything like that. So the pilot exercise was 4 guided sessions, each an hour and a half long, and we participated between March and May. And these sessions really provided a structured guidance to assist jurisdictions navigating the planning phases of an overdose spike response exercise. So ASTO and ORS participated in these sessions. It was really helpful because it kind of took the outside meetings out of it. We were able to plan essentially an entire exercise in these 4 1.5-hour meetings because the toolkit is so comprehensive. So we'll get a little bit into what the toolkit has and is very helpful. The toolkit includes a partner list. So this list includes a list of suggested key response partners who might participate in the spike response preparedness exercise. So the response team can use this document to brainstorm key partners, track contact information, and invitation status for the exercise. I thought that was maybe the most helpful thing in this toolkit. I think it's really easy to overlook key partners. depending on where you sit on either side, and making sure that everyone was involved, from the libraries to the FACE system to the hospitals to the schools. It was really great to have that list to work off of. The toolkit also included the mock scenario and inject inventory. So this document is a menu of options for exercise facilitators to select from when determining what injects to include in their overdose spike preparedness exercise. Again, that's kind of like choose your own adventure, depending on your jurisdiction. Brett and I will go into a little bit what Frederick County chose to use, but it really does have a wide array of options to choose from to make it fit for wherever you are. Then there's also the exercise slide deck. So love this. The PowerPoint is already ready for you. You just kind of have to copy and paste depending on what you would like for your injects. These slides are really a template for the response teams to adapt and use to structure the exercise. We really used this PowerPoint slide deck. I don't think we made that many edits. It's a really smooth, seamless way to organize this exercise, we found. Then finally, there's a resource list. This document outlines key resources on overdose spike preparedness and response strategies that can help assist exercise facilitators and participants before, during, and after an exercise. So those really are the key stages. It's the planning stages, the actual day of, and then where you go from there. Oh, Michael, we actually are not using slides. We are just chatting to you. But we can put together some stuff to send out if that would be helpful. Brent, I'll pass it over to you for planning the exercise, who we chose to include, and how we put it together.
Great, thank you. You did a great job, Spring. So the planning stages were critical in this. So we just have virtual meetings, like Sabrina said, for about an hour and a half long. We include emergency management, law enforcement, local public health throughout that region. So our Frederick area is a very slender part of our state. Okay, it's a commuter area to DC. It's bordered by Virginia or West Virginia and Pennsylvania. So the community that uses drugs, well, they don't know boundaries. They go in and out of that area. So it just throws a different type of dynamic and another need for communication, right? So also is a major thoroughfare there, Route 70, which runs pretty much coast to coast, right? So that's one of our main drug trafficking routes. So they have a problem, and they're only not even an hour from Baltimore City. So as we approach this with our partners and the actual day of, we had certain thresholds that we thought we'd met as far as how many overdoses would it take to overload our system? How do you respond? Who makes the response? Who calls this plan into action? And we went in there thinking that they could handle up to 7 overdoses at a time, but in reality, we're talking about fire and EMS, it was 3. Then speaking about who's going to send the alert for something like this, would it be the hospital? There's only one in that area. Would it be the EMS system, fire, the 911 calls? That's still in the air, right? We're still on this back. We're still doing some planning with them and trying to work things out, but it sounds like it's going to be a multi-phased alert system. So just the partners working together who are on the ground to say, hey, we're having an issue. And then also planning on what resources are available, right? How many medic units are out there, what's tied up, what isn't. So after the scenario, and this one was a lot easier to run after using the toolkit, we were able to approach these issues and highlight some gaps to what we're still working on as an after action. So it's a very powerful toolkit. It's a great scenario to run, and with the right partners in the room, I think you really do end up making a large difference, or could be making a large difference if a scenario such as this were to come your way. Sabrina.
So for Frederick County, some of the injects we chose to use were novel psychoactive substances. So we included, I believe, a medetomidine inject, because that's something we're seeing down here in Maryland quite a bit. I think that one was really important, both education-wise, to educate those partners who might not know what medetomidine is, how to respond to an overdose that's not necessarily just opioids. everything like that. That was something Frederick County themselves that were very interested in exploring because they did not feel that their response system was ready for a medetomidine involved spike. We also discussed the rurality of Frederick County. So having a spike of overdoses both in the urban setting and occurring in the rural encampments, and how we would, adapt to that scenario, get response teams out there, how we would communicate between EMS and public health, and how we are communicating to the public as well. So those are the ones that we really focused on, which I thought were great, but there are, so many different injects that you can include. You can include a spike occurring on a holiday weekend when people are off, or when your main communication person is not in office. There are a lot of different ways to tweak this exercise to make it work for you and really test out how much your response system can handle. And for us, it really illuminated some areas that we did not view as problems at the beginning of this exercise. So that was great. Something that is important to keep in mind when planning the exercise, I kind of mentioned this already, is the kind of core planning team that you're bringing to the table. I would highly recommend not just including public health or not just including public safety. I do think a multidisciplinary team there is really helpful for getting buy-in and bringing people to the table, and also planning this exercise in a way that, again, we're seeing those gaps across the board. We also included public health emergency preparedness, who were, in our case, really integral for helping to pull this exercise together, get everyone at the table, and organize the after action report afterwards. So if that's an option in your jurisdiction, we highly recommend. They really kind of have these plans down and know what they're doing. So our emergency preparedness person was a really great person to be the facilitator for this exercise. As far as how we did this virtually, hybrid, in person, Frederick County felt very strongly that we should do this as a hybrid exercise, which is not necessarily something that ASTHO and ORS recommends, as that can be just a little tricky with technology and participation and all of that. In our case, it ended up going pretty smoothly. We had probably about 25 participants in person, and then I think we had about 30 online. The participation was really great. I was really impressed with what everyone brought to the table. We did have technical difficulties, so that is something we test out a couple weeks before, we tested out a couple days before, and we still ran into difficulties. So I'm sure everyone is familiar with that in this post-COVID age, but I would recommend, having a backup plan in case everything falls through. ASTHA recommends having 2 sessions, 2 2-hour sessions, if that's possible. Frederick County did not want to do that. They wanted to accomplish everything in one day to make sure that they could have everyone at the table at one time and finish it. So we did 1 3-hour hybrid session. That worked really well for us. We had to be a little strict about cutting those conversations short when they were, running amok. But other than that, we were pretty well able to accomplish what we wanted to do. So I do think that's possible if you'd like to not do 2 2-hour sessions, or you could do it during one day, have a break for lunch, and come back. We did not have any funding for food, so we weren't confident that we would get people back in this room. So we did it all before lunch. Brent, I'll pass it over to the day of the exercise for the problems we identified for future consideration.
Well, for the day of the exercise, like we mentioned, we drew a lot of interest as far as including partners across state lines, right, for a larger event. So who those partners would be, and who would be selected, as Sabrina mentioned, the people you bring into the room make or break this project. So as follow-up exercises, we're currently looking into going into West Virginia and Pennsylvania to try to get those partners engaged. As far as the problems they identified, again, as I touched on earlier, it was like manpower issues, what municipality can bring what, and where the scenario would play out. If it's an encampment, clearly it has to be a lot different than an urban environment. And then what process do you use for that, right? In our area, those encampments move. So as they're moving, how do you identify them? So there's one in particular in that area that's about a half a mile walk back into the woods. So by having that group together and knowing what the county can provide, I mean, we're able to source out drones, right? As opposed to people marching through the woods looking for people to try to help. So those are all things that can be used and are very useful. And it wouldn't have came true. We would have found this in the fruition and made this plan without having this exercise. So I think it's very, very important. Sabrina, you want to touch on the next steps and get partners involved?
Yes. So again, after our 3-hour exercise at the end, we did do a hot wash to figure out what were the issues we wanted to circle back to and make sure, you know, we filled in those gaps and identify. We didn't just do the first step of identifying, we had action steps to continue to work on our response. As Brent mentioned, a couple key things that came up were really identifying for Frederick County what qualifies as a spike. That is really the first big question. During the exercise, we had to start with what qualifies as an overdose, and then at the end, we still had not fully identified what qualified as a spike. So we've met a couple of times afterwards to figure out what that number looks like for Frederick County. We also identified that there were some gaps in the hospital system with peers. There were times during the day where you would not have a peer available, which I don't think was really a issue that had been brought up at the beginning, but was kind of essential if there was a spike happening. Additionally, we brought up that encampment mapping. There is, you know, some protectiveness of keeping that information close within the health department versus sharing it out with public safety. That's something that they're navigating to this day, kind of figuring out the plan for if a spike overdose does happen in an encampment. How do we share that information in like a safe and comfortable way? Finally, something that we were worried about going into this exercise, which was really illuminated, was that Frederick County is such a, you know, entwined, great communication. They've got a lot going for them there. But we were worried about kind of shining light on those cracks in the institutional knowledge once people move on from their positions. There was no written communication guideline. The flows just happen naturally because these people have such long, great relationships. But something that we really highlighted is preparing for when that changes. It's not just going to be a seamless transition when someone else steps into the job. And that's something that they're really working on, is highlighting this communication chain and flow and what are the processes for communication, both inward and outward facing, when a spike response happens. So with all of those gaps that we identified, and there were a number more, our public health emergency preparedness facilitator prepared an after action report laying all of this out. And during the day, we identified subcommittees of folks who would like to kind of tackle these different issues. So that's where we've been so far going forward, really working on nailing down this spike response plan, having it in writing, and then being able to review that and edit as we see fit and going forward. And something, again, that was great about this exercise is it included everyone who could touch the overdose landscape, which is really important. I don't think we're necessarily always bringing the libraries into the table, and they are such an important communicator to the public. They were really great in this exercises. We also had the state come in and talk about how they could help. And then we had a lot of different, just people who wanted to view how this exercise would work, which was exciting. And I think it's really spreading its wings and, you know, happening in different areas. In the pilot exercise, it was Maryland, Delaware, New Jersey, and Tennessee and Mississippi, who have all put on their own spike response exercises here. And Alaska, Idaho, and South Dakota have also tested the materials, but kind of adapted it to their own needs outside of the pilot exercise. And Brent, do you want to talk about our plans for the future?
All right, so Sabrina touched on our state health department's now involved with our work with this process. So moving forward, as you know, as we do our tours, Sabrina and I, we break our state into fourths, and we spend about a week in each fourth. We normally talk about drug trends and programming and how can we help and where are the gaps and how can we assist with filling them. One of the things we're going to start offering is this tabletop exercise at the county level, and the state wants to be involved with that. So I know I'm excited to do that, to bring these partners together and try to fill these voids within each county, and then try to get these counties to work together, and more importantly, even across state lines, as I mentioned earlier. So again, I support this. This is great. I think we're planning on going towards Montgomery County, which is a county right against DC. Really pitching it there within the next week or two. And then we're going to St. Mary's County, and again, another county. It's very close to DC. So things are moving forward. We're having a lot of buy-in and a lot of interest from our partners within the state. And I'm sure if you guys were to look at this material, you probably have interest also. So there it is.
Yeah. So within our cohort, people did it in very different ways. We had a couple of states that did entire state spike response tabletop exercises, which feels like a big way to start for your first exercise. We had a couple jurisdiction or states that did just jurisdiction-wide exercises, which is what myself and Brent opted into. And then we had a couple that did regions as well. So you can really tailor this toolkit however you'd like to use it. I would say we took the longest out of any state to put on their exercise. Again, I mentioned that it was from March to May. A lot of states had their exercises in June or July. We waited until September just because of the craziness of summer scheduling, which I think was advantageous for us. I would keep that in mind when sending out invites. But you really need probably 2.5 months to put this fully together, I would say. We do have some slides we can share with you later on. The toolkit, unfortunately, is not public yet. They're still making a couple last-minute edits. But if you are interested in exploring this, you can reach out to Amanda, and she would be happy to get you connected to Ask Though and the toolkit. So yeah, we can take any questions.
Thank you both. That was very interesting, both the prep and the project itself. People have questions, comments? All right. And if you send us the material, excuse me, we'll get it out to people on today's program. So thank you both.
Wonderful. Thank you.
Thank you. And next, we're going to hear from Allison Burke. And Allison is the executive director of Namaste Sober, which brings together a number of things: her background in marketing, entrepreneurship, and yoga. Her journey, like so many of our folks in this work, became personal after she tragically lost her younger brother to addiction. And that experience really inspired her to help others rebuild their life with strength and compassion. And as a yoga teacher, she integrates mind-body wellness into leadership, always trying to build community and resilience. Namaste Sober is a nonprofit founded in Boston in 2015 to support individuals in recovery by reconnecting their body and minds through affordable yoga, fitness, meditation, and sober social community events. And that's something we've talked about a lot before, how difficult it can be for people to find some place to just go and have a good time where they're not going to be putting themselves in harm's way or temptation. Namaste Sober really believes in the power of that community and movement as being a way to prevent relapse. And they offer free yoga, fitness, and meditation classes. They provide scholarships for yoga and gym memberships for individuals in recovery. And the vision is to replace potentially harmful addictive habits with healthier life-affirming routines, and at the same time develop a supportive, non-judgmental community. So Allison's going to talk to us today about Namaste Soba's programming, and we're happy to have you here, Allison. Thank you.
Yes, thank you, Marion, for that introduction. I'm sorry I'm running around today, so my background is my car, but I am parked safe. So anyhow, and thank you for everyone else who has shared. And yeah, so our program, Namaste Sober, we bring yoga and meditation and fitness into recovery communities. So one of the ways, we have three kind of core programs that we are currently running. One is our yoga for recovery, in which we go into addiction centers and we go into treatment centers and sober homes, and we bring classes right into those spaces. So that program is pretty flexible, pun intended, but dependent on what spaces are looking for. We can come weekly, we can come monthly, we can do just like one-off events and things like that, depending on what makes the most sense. Really, wherever there's space, we can set up a class. There's been sober homes that don't have space for a whole yoga class. We can come in and do meditation, or we've just now started to integrate more sound healing. One of our instructors brings in like the sound bowls, and that has been something that has been very beneficial to our participants. Our other program is our Namaste Connected program, in which we partner with already existing gyms and yoga studios. So it's not just yoga. Our belief is really finding any type of movement modality. So for some people, yoga has been like a great path to recovery and something that they can lean on and lean into the routine. Others, it's been gym. We have partnerships with boxing gyms. We have partnerships with spin studios. So we try and offer at least a few times a week a class that's for anyone to go to. So our yoga studios that we work with and gyms have been very generous, and that they will give us a time slot during the week. So for instance, on every other Sunday, we have a class at a yoga studio that's open to anyone, and it is open to beyond the recovery community. So in this instance, you don't have to identify as being in recovery to take the class. If there was someone who had a family member that was struggling and wanted to try yoga, the family member could come. So it wouldn't feel like you're going into an AA or an NA meeting or something like that. As an outs, like anyone is welcome. So that's kind of a way to build more community. We ask that anyone that comes into our spaces and classes are not under the influence of anything that's not prescribed. And then our third program is our scholarship program. So also with these partnerships that we have with the yoga studios and the gyms, we are able to offer people that are in recovery with a scholarship for up to a year. So it normally starts as like a 3 to 6 month trial. And if fitness and movement and meditation and yoga or any of the above are like something that is helping someone sustain their recovery, then we want to help them out, because there are great financial barriers, especially now, to get into gyms and to yoga studios. So we are able to offer a free membership, and then that program is a little more in depth, where we offer it 2 times a year. There's a cohort. We have 6 studios that we currently partner with for the scholarship program, and we do an onboarding, and we just did our fall onboarding, and so everyone from all the studios get to come together. So there's about right now, this cohort, we have about 25 people across greater Boston going to these different yoga studios. And then at every studio, there's a peer support host. So there's someone that's either already been through our program or has experience with addiction, or it's touched their lives in somehow, and they're there as the friendly face. They'll take your first class with you when you're new to the program. They're going to help get you set up and be like, take this class or take that class, or their responsibility is to have like a consistent schedule. So if the new person coming into the scholarship program, they're trying to figure out what their schedule is going to look like or what classes to take, they know that there's someone there that's going consistency that they can they can tag in and be like, hey, I've been struggling, like work's hard or this aspect's hard. I can't get myself there. Like, when are you going? So there's a buddy system, there's peer support and accountability within this program. We've had major like transformative success with people. You know, it is another way to build community, and we host events quarterly with this program. So every 3 months, everyone that's in the program comes together. We celebrate the 3-month milestones, the 6-month milestones. And then after you've gone through the program for a year, then you become eligible to become a host. And then you can get another year scholarship, essentially, if it's something that's working for you. So those that's like I know I just gave you a lot of information. That's the basis of what we're doing, but each one of those programs is easy to like plug and play into different communities. Like, if you, right now we are working to expand into Worcester, Massachusetts. And, you know, I have a woman there that's, you know, she came to one of our events, and we did a big event in City Hall Plaza over in the fall for Recovery Month. And, you know, she's like, we need this here. And so she's been getting together treatment centers and yoga studios. And, you know, we're planning on doing a kickoff event, and then, you know, starting to implement classes in some addiction treatment centers or sober houses there. And then also the scholarship program, and then just having free, you know, classes that people can go to without any, you know, you don't have to go 3 times a week. It's just kind of like, we're here, we're all, you know, we're all sober in the space. Another aspect of things that we've also done is, you know, activate sober spaces within, you know, if there's events that are where there's, anyway, that doesn't really apply to this call, but that was just something else. Like, there were other big events going on, like in the city, like polar plunges, and, you know, there were beer companies or anything like there that were sponsoring it. And I'm like, can we have a sober station here so that there is a space, so that, you know, you don't feel like you have to come out of the thing and drink a beer or be like, I can only have soda water. Well, we have other non-alcoholic drinks over here. Yeah, that's like the basis of what we're up to. But I think in terms of, you know, opioid addiction and helping people from, we kind of fall into the categories of prevention, because we are helping with building community and healthy routines, and helping people stay like on the track of preventing relapse and preventing overdose. But then also we are the peer support and helping people that are in recovery piece of the program. So we kind of see ourselves as a complementary program to, you know, medically assisted programs and NA and AA and things like that. We kind of, you know, if movement and mindfulness and exercise is going to be the thing, like, we want to make sure that you have access to it. So. Oh, you're muted, Marion.
Sorry, thank you.
Yes.
Questions, comments? No? All right. And
Okay.
do we have your info, Allison, like anything?
I can provide some slides and some marketing materials.
Okay.
If you're on social media, you can find us, like, we have our website, our regular website. It's namastesober.org, and everything is there, our events and everything like that. But we're also very active on Instagram and Facebook, so you can see what we're up to there as well.
Great.
But yeah,
Great. Thank you.
yeah,
Thank you.
thank you for having me.
Of course. Anybody have any updates they want to share? Any program updates? No? All right. Again, I remind people, anything you need, Narcan, fentanyl, xylazine, test strips, we're happy to make those available. Excuse me. Thank you for being with us, and happy Thanksgiving to everybody. Take care. Bye-bye.